Welcome to the South Florida AGC's second Wednesday safety session for March 10th, 2021. My name is Carlos Carrillo. I am the Executive Director of the South Florida AGC. And as we do every month, I am just really excited to be here in front of you guys today. We're broadcasting live from the Safe Right Solutions Training Center in sunny Doral, Florida. So those of you joining us outside of Florida, come visit us. The weather's great. I want to thank the Safe Right team for hosting us today, as they do every month since things have started. I'm really excited to be able to do this every month and be able to get in front of all of the safety community in South Florida. And now that we're broadcasting abroad. So thank you all very much for joining us. I also want to recognize the team at Kelly Cronenberg. These are the folks that help us out with the technology. I'm just a lonely association executive, but the team at Kelly Cronenberg really makes us look great and provides a great backstop for any technical issues that pop up. So thank you to Kelly Cronenberg and their team out there. Before we get to our guest today, we have to recognize our title sponsor. If it wasn't for our title sponsor, we wouldn't be able to buy all the wonderful equipment that we have to be able to present this today. So there he is, the great Uriel Soto. Mr. Soto, welcome to the party, sir. What's going on over at Milwaukee?
Hey, morning, team. Just want to start off by thanking the South Florida AGC for the continued support in the market, continuing to put these safety events on and connecting these safety professionals in the Miami and Broward area. Most importantly, obviously, we got a lot of great events coming up with the South Florida AGC. So thank you for coordinating those in a COVID-friendly fashion. And then I also want to thank the members for embracing the Milwaukee tool as a partner in the market and for the continued support, continued reaching out to us. And again, we have plenty of resources in the South Florida market to continue to drive a safer and more productive work environment. So again, Uriel Soto out of South Florida, more than happy to work with your team with the safety week coming up. And feel free to reach out to me if you have any questions on how we could support and work with your team.
I forgot to unmute myself. The phrase of 2021, you're on mute. Hey, Uriel, come on camera one more time, my friend. What is your email address for folks to be able to reach out to you?
Yep, that is going to be uriel.soto@milwaukeetool.com. So URIEL.SOTO@milwaukeetool.com.
Awesome. Thank you, Uriel. We appreciate all your support, man. Uriel is one of our sponsors for our Contractors and Clays tournament presented by Nielsen Hoover Group. That's happening next Friday. I have 2 teams left to sell, and we're going to be sold out of that event. So if you guys got your shotguns, you want to get out and do some competitive sporting clays, come on and join us. We'll be in Okeechobee County at the beautiful Quail Creek Plantation. It's a amazing space. So if you'd like to come on and shoot with us, make sure you check that out on our website, sfagc.org. Also, want to let you all know that our second Wednesday safety sessions can now be found on YouTube. So if you're on YouTube, make sure you search for the South Florida AGC. You're going to see our channel. Hit that subscribe button and make sure you like those videos. We currently have October through February safety sessions up on the page. And very cool. It is Women in Construction Week. I'd be remiss if I didn't mention that. And for Women in Construction Week, we do have a series of interviews with 5 great women in the industry. So jump on up. I believe we have 3 interviews up. Today is Wednesday, so our 3rd interview went up for you all to check it out. Now, news in today's society is everywhere. And news about what is happening in Washington, D.C. is usually the main headline. However, very rarely is anything having to do with OSHA ever mentioned unless there's an accident. Most people don't realize the impact that OSHA has on their everyday lives. And that's not the case with us and you all out there in the safety community. The change in leadership in the executive branch brings a change in leadership at all of the governmental agencies, including OSHA. We know that change is coming at the agency, but what is it going to look like for us? Today's guest is well positioned to help us answer that question. Kevin Cannon is not only the Senior Director of Safety and Health at the Associated General Contractors of America, he is currently the Chairman of the Advisory Committee on Construction Safety and Health, which advises the Assistant Secretary of Labor for OSHA on regulations, standards, and policies that impact the construction industry, that impact you and all of those workers that you protect on the construction site. I took a peek at Kevin's presentation, and I'm really excited to hear what he has to say, and I'm really excited to hear what questions you all have. So without further ado, Kevin Cannon. Kevin, please.
All right, thank you, Carlos. And
all right, we got the mic working, we got the presentation up. Kevin has been the smoothest presenter. No lag. I love it. Thank you, Kevin.
You're welcome. You're welcome, and thank you for the invitation. Just a little bit more about what we do here at the national office. As Carlos mentioned, I'm currently the chair on the advisor on ACCSH. Go back through the whole title of it, and part of the responsibility of the committee, as he said, is to advise the assistant secretary on policy initiatives, rulemakings, and whatnot that will impact construction. I think as we all witnessed over the past few years, things were kind of quiet with OSHA's on the regulatory side. However, we do anticipate that change. So what I'll do today is run through what we see at the national office as far as the focus or themes for the new administration. And so with that, I will get started. All right. Hold on. There. All right. So, I think back in December, this statement by President Biden kind of set the tone or expectation as to what we might see from the agency. And this is just a few excerpts from that entire statement, and it was celebrating the 50th anniversary of the Occupational Safety and Health Act. And basically, he highlights the fact that the number of compliance officers are at the lowest level since 1975. Enforcement will be key. And he will direct OSHA and other relevant agencies to develop comprehensive strategies for addressing the most dangerous hazards workers encounter in the workplace. And, of course, up front, it's pretty clear when you talk about the number of inspectors that hints at increased enforcement. But, the development of comprehensive strategies can be interpreted in many ways. In our view, we believe that will involve some new rulemaking initiatives, some specific to construction. Others are more of your horizontal type standards, and we'll cover some of those when we talk about the regulatory agenda. So, I would say increased enforcement and a little bit more activity on the regulatory side. Just to give you an understanding of the leadership at OSHA, the Secretary of Labor, I think he made it out of committee, but yet to have a full Senate vote, but that will be Marty Walsh. He is a second-term mayor out of Boston. He has strong labor ties. I do believe he, held leadership positions with the laborers as well as the building trades in Boston. During his confirmation hearing, he repeatedly emphasized that OSHA will be a priority. So that will be a focus of his. The current principal deputy assistant secretary is Jim Frederick. Jim comes from the United Steelworkers. He spent 25 years there as the assistant director for health and safety. He was in retirement and, worked with other groups, but he's currently in place as far as a assistant secretary, I think, as far as the org chart goes at OSHA, you have the assistant secretary, and then you have the deputy assistant secretary. We do have, as you can see, Jim Frederick in place as the deputy assistant secretary, but right now I've not heard of any names being floated for the assistant secretary position, but we will continue to monitor it. And as we always do when new leadership comes in, we'll go in, introduce AGC to those individuals just to re-emphasize, our focus on safety. Everything we do is built on safety, and we want to make that clear. Sometimes these folks are not familiar with AGC as an organization, so it's good to get in and make an introduction. And we've yet to secure a meeting with Jim. However, we've been working on it, directly in contact with him and his chief of staff, but also with some of the career folks are assisting us with securing that meeting. And as I mentioned, there could be, will be increased enforcement, increased regulatory activity, and I say potentially. And as far as the decreased focus on partnerships, I think that might vary on the local level, but during the Obama administration, there were some efforts to revise or revamp these partnership programs, as they felt like it gave participants a free pass, so to speak. We went in and argued otherwise, saying that a lot of the benefits that are offered through partnership programs are earned by the efforts of those who engage with the agency. I think you all are aware, especially those who are involved in partnerships, that you do all the work and OSHA gets all the credit. However, there were some who felt like the benefits associated with it were essentially giving participants a free pass. So again, these are the things that we'll be focusing on and helping to alert our members as far as developments go. Just to give you an idea, what that means as far as increased enforcement. If you see, FY 13 through 15, those were the tail end of the Obama administration. And with those figures, there was an average of about, I'd say, 35 to 36,000 inspections, annual inspections. This is just federal inspection, but Florida is a fed state, so it is applicable. And then if you look at FY 2016 through 18, those numbers dropped, and you can, attribute some of that to the staffing levels within OSHA at the compliance officer level, but they averaged about 32,000 inspections per year. And the significance of it is that generally construction accounts for 50 to 55% of all inspections. So, if you just do simple math, with a difference of about, 4,000 or so annual inspections, construction can see about, I'd say, 2,000 to 3,000 more inspections per year. Just to add a little bit of context to this enforcement initiative, there are reports that the agency is looking to double the number of compliance officers that are currently on staff. And in addition to adding staffing, they are looking at, revisiting or refocusing on the Severe Violators Enforcement Program, or SVEP, which was previously the Enhanced Enforcement Program. And basically, for lack of better terms, that's where, employers find themselves on the naughty list, and you're subjected to routine follow-ups and, corporate-wide inspections until you are able to free yourself from that list. So enforcement is going to be key. And I'd say, ramping up enforcement is not going to be overnight. They have to put these compliance officers through training and such. But again, I'd say over the course of this administration, you will see an uptick. Just to get into, the hot topic of the past year, COVID-19, there was an executive order issued on January 21. And for those of you who have read it, I apologize for the repeat, but what it did was directed OSHA to issue revised guidance to employers. That was issued on January 29th. So, they did meet that goal. One of the other significant items in that executive order was to consider, consider is the key term here, if an emergency temporary standard or ETS is necessary, and issue it by March 15. By all indications, especially given the Inspector General's report that was issued last week, I'd say it's a foregone conclusion that we will see an emergency temporary standard for COVID-19. What will be in it, uncertain. This is not your usual rulemaking process where they're required to issue a notice of proposed rulemaking to allow the regulated community to weigh in, and then they analyze those comments. The ETS is not subject to the Administrative Procedures Act up front, so they can issue a standard. It becomes effective immediately with enforcement shortly thereafter, and then within 6 months, they're to issue a permanent standard. We've had some conversations with some of the staff over there just to get an understanding as to what this emergency temporary standard will look like. Our our argument, or not argument, but position is that construction should not be regulated at the same levels as, say, healthcare. And when you talk about healthcare, you're talking about ambulatory services, hospitals, long-term care facilities, and such. We feel as though we're in the low to medium risk range and should not be subject to the more stringent requirements of those higher risk industry sectors. What I've been able to gather from my contact with the folks at the federal office is that what we'll see is a standard that covers healthcare and then everyone else. So construction will be lumped in with retail, manufacturing, everything, all industry sectors outside of healthcare. One other thing, again, is to launch a NEP, National Emphasis Program, to focus enforcement efforts on COVID-19. And then, of course, respond to any anti-retaliatory practices undertaken by employers. For those of you who might work in state plan states, they are to follow suit as far as the guidance and the ETS is concerned. And then also for those who have dual compliance obligations under OSHA, MSHA, MSHA must also do the same, consider if an emergency temporary standard is necessary. As I mentioned, the guidance was issued on January 29th. Overall, it contained, I think, everything that we've been doing to protect workers and job sites from, transmission of COVID-19 since the beginning. These are some of the things that I pulled out of the new guidance that are a little bit different, or additional recommendations involving employees and their union or other representatives in the development of the COVID-19 plan, making the COVID-19 vaccine or vaccination series available at no cost to all eligible employees. For those who are required to comply with the other standards, health standards that have some medical examination or medical testing provision, this is very similar to it, even like the silica standard where you have to make the medical exams available at no cost. And, that it doesn't constitute a mandate. You just have to make the offer, and employees are, they have the ability to, refuse the offer. One of the other things is also providing information and training on the benefits and safety of vaccinations. I'd say this is bullet number 2. While AGC does not support any, federal mandate for employers to require their workers to be vaccinated, we say, you consult with your legal counsel as well as your employees and develop your policies accordingly. However, we do support this. In fact, we're part of a larger coalition of about 30 other trade associations. And what we're doing right now is working to coordinate or plan a vaccination awareness week. And basically it's just encouraging employers to educate their employees on the safety and benefits of the vaccinations. And what we'll do is use the CDC information that's out there. One thing that AGC is also working to do is to produce a pre-recorded message with one of the medical advisors at CDC, just again, re-emphasizing or reiterating, the benefits of broad vaccinations. Minimize the negative impact of quarantine and isolation on workers. For those who are familiar with the Family First Coronavirus Recovery Act, there was a provision in there where employers were getting tax credits for giving individuals time off that were required to quarantine. That was due to expire March 31st. With the Recovery Act that just passed, I do believe that is extended through September. So, that's really not in the OSHA bucket, but, that is one of their recommendations. I think this next bullet, many of us already have such programs where we do not, or policies where we do not retaliate against workers for raising safety and health concerns, and it not necessarily specific to COVID-19, but it could be any hazard on the job site. But they do put a recommendation in there that's specific to COVID-19. This last bullet may change, or as far as the recommendation is concerned, given that CDC has updated its guidance for vaccinated individuals. But in that January 29th guidance, they recommended that you do not distinguish between workers who are vaccinated and those who are not. And essentially what that meant is, for those who are vaccinated, they are required to still follow the public health protocols as far as social distancing is concerned, wearing face masks, routine washing of hands and so on. So that is just a summary of what we see as the differences in the new guidance versus the previous guidance. One thing I will say is that in my conversations with the folks at OSHA, any of these recommendations can find, as they put it, it's within the realm of possibility that any of these new recommendations could be included in the emergency temporary standard. So, that's what we're looking at right now with COVID-19. What I would say is, you can expect the emergency temporary standard or announcement related to it on or before March 15th. Their typical approach is sometimes issuing these initiatives or announcements on a Friday afternoon, I guess, when folks have checked out for the weekend and come back Monday and you have this great surprise. So I'd say between now and Monday, you will see this. What I'll go through right now is the fall regulatory agenda. What I'll say is a lot of this is subject to change because this was issued under the Trump administration. So, as the new administration came in, there was a freeze on any regulatory activities, and that's not unusual, as they'd like to see, what rulemakings are being worked on. And, if there are things in there that does not align with their policy goals, they could be suspended and new initiatives introduced. So I'll just go over the list, not quickly, but, as quickly as necessary to give you some background as to what these entries on the reg agenda mean. The first one, I think, is a huge one, and that's the revision to Table 1 in the standard for the silica standard for construction. AGC has been involved in that rulemaking since 2012-13, and one of the things that we've been engaged with the agency on is to expand Table 1. We feel as though Table 1 is a great compliance tool. However, it's limited in the tasks or tools as well as the engineering controls that are included within it. During the proposed rulemaking phase, the draft standard, you had the either or. you had either the dust collection system or water delivery system. And what we saw in the final rule was a lot of the dust collection engineering controls were removed from Table 1, and that was based on limited data that the agency had to go on. So we've worked with the building trades to put forth some tools and tasks, working with agency members and chapters to identify these additions, and they're under consideration. They issued a request for information in 2019. We responded to it, and now the agency is currently looking at those comments that were submitted to determine which way they go. With an RFI, they have the ability to either move forward with rulemaking, or they can say we didn't get enough sufficient data, and we're not going to do anything further on it. Our hopes are they will move forward. One thing I'll say is that there was mixed feelings about expanding Table 1 amongst the agency chapters and membership. AGC came to the position that we felt like this was beneficial to the majority of our members, so we did support it. However, we've not seen any additional action. The current, and I didn't put any dates on here because they're subject to change again, because this was put out under the previous administration. But a proposed rule was due out on this in March of this year. We still have some time, but I do not believe they'll meet that. Another entry on there is powered industrial trucks, and this is two initiatives. One really has little to no impact on contractors, and that's updating the standard to incorporate by reference the latest ANSI standard related to design and construction. That's really more focused on your manufacturers. However, there's another initiative to follow to update this standard to align with the latest ANSI standard that's related to maintenance, operation, and safe use. So, if any of you are familiar with the ANSI MEWP standard, they are looking to update, well, while they did not update the aerial lift standard to incorporate by reference the latest ANSI MEWP standard, they are looking to do that with the powered industrial trucks. Amendments to the cranes and derricks and construction standard. That is to clarify some of the language in there. The biggest issue, I think, for contractors is how forklifts are treated under the current standard, whereas they say if it has a winch or hook, it would fall under the scope of the standard. They're looking to update that language. I think they finally realized that was a typo. So it's going to say a winch and hook instead of winch or hook to fall within the scope. Update to the hazard communication standard that's already been published, and it's essentially to align the HAZCOM standard with the latest revisions to the GHS standard. As far as the impacts on contractors, it would, if there are any changes to the chemicals that you use, it would require you to secure the revised safety data sheets, do any any necessary training for any revised hazard statements or pictograms. So that will have a minimal impact, but just wanted to make everyone aware of it. Drug testing program and safety incentive rules. For those who followed the electronic record keeping, they did include an anti-retaliation provision in it. And the language gave the appearance that drug testing programs and some safety incentive programs would violate the record keeping rule. As under Dr. Michael's tenure, they felt as though broad drug testing and certain safety and incentive programs would suppress injury and illness reporting. There was a volley of enforcement memos sent out to the regions. The Trump administration sent one out and said, hey, these programs are not in violation of the record keeping rule. And, understanding that enforcement memos can be rescinded. and changed, according to the policy positions of, any administration. They wanted to codify this or memorialize it, as they said, into the record keeping rule. That one, I would say, may not get any movement. Excuse me. And then PPE in construction. This is something that started, I'd say, back in 2012 within ACCSH, and it really began with a focus on proper fitting PPE for women, but it expanded to, construction workers in general. And what this, proposed rule would do is align the construction PPE requirements with that of general industry, where they just said PPE must be of proper fit. The one concern we have with that is that fit can be subjective. There are some types of PPE out there that may not be as an exact fit, but afford the user or wearer of the protections that it was designed for. So that's something that we'll weigh in on, whether it be through our coalition or ADC independently. Then there's the medical removal provisions in the silica rule. OSHA did not include it in its original rule, but they were sued by some of the labor groups saying, hey, there should be some medical removal protection in the silica rule. OSHA justified not including it in their original final rule by saying, this isn't like the lead rule where, your blood levels normalize over time. Once you got silicosis, you got it. Removing the individual from the environment does nothing to reverse the illness. So, we'll see where that goes. And then respirable crystalline silica in the mining industry. MSHA is looking at a rule, not sure where they are in that process. They did hold a stakeholders meeting a year and a half or so ago, but no further movement at this time. On the long-term action stage, you'll see I have infectious disease standard. I think that can be, scratched with the pending ETS on COVID-19. And I think the permanent rule may be a broader infectious disease standard. So that may be removed from the long-term action stage. And then you have also the MSD column on the log. And what OSHA is looking to do is reintroduce a column for employers to check if an illness, injury or illness falls into the musculoskeletal disorder category. Potential rules, heat illness prevention standard. Back in 2019, the agency was petitioned to issue a rule in light of the fact that California, Minnesota, Washington, among others, have heat illness prevention standards, and the federal OSHA does not. There was a hearing held in the House on it, and the legislation that was introduced would have required OSHA to issue an emergency temporary standard with a final rule about 24 months after. That has not gotten any movement, but I don't know if legislation will be required under the new administration to initiate rulemaking on it. Electronic record keeping, you all are aware, and it's been in place for some time now, that you're required to submit your 300As to OSHA. Well, the original rule would have required the detailed information from your 300 log, as well as the Form 301s or the incident investigation forms. They scaled that back to just require the summary, but I can foresee that the new administration would propose rulemaking to again require employers to submit their more detailed information. And we could very well see an injury and illness prevention program standard. That was a huge focus under Dr. Michaels. They kind of ditched that effort to focus primarily or solely on silica, and we could see them going back to that. Some legislative activity, Marijuana Opportunity Reinvestment and Expungement Act, or the MORE Act. While it's not specific to safety, it does have some safety implications. What this piece of legislation would do would decriminalize marijuana at the federal level. It would not force states to, follow suit, but I would suspect there would be many that would. What is concerning to us in this particular legislation is that it would prohibit employers from conducting drug testing unless for marijuana, unless the individual fell under the DOT regs for drug testing. So, we submitted a letter to the House with the National Safety Council. We also submitted one with our coalition partners, just saying that they needed to carve out some protections to ensure that employers had the ability to maintain, their drug-free workplace policies. Accurate Workplace Injury Illness Records Restoration Act. One of the things that OSHA passed under the previous administration, well, not the previous, but under the Obama administration, was what was considered the Volks Rule, and what that would have done was given OSHA the ability to cite employers for record-keeping violations going back 5.5 years. We argued that under statute, OSHA cannot cite you, outside of the 6-month time frame of the occurrence of the violation. Well, they argued that any errors or omissions on your injury illness log constituted an ongoing violation. That was rescinded under the Congressional Review Act. However, there has been, a handful of members of the House Ed and Labor Committee who reintroduced legislation that would again give OSHA the ability to cite contractors or employers for these errors or omissions going back 5.5 years. And one thing, and this is just again, the last one is just speculation on my part, is the Protecting America's Workers Act. During the Obama administration, there was legislation introduced that would have updated or revised the OSHA Act. And there were two primary focuses of this legislation. One was to increase penalties. That is no longer an issue with the budget agreement that was entered into prior to Obama leaving his presidency, which now, civil penalties are adjusted, annually according to inflation. So I don't think that will be a focus. What I do think might be a focus of this piece of legislation is enhanced criminal penalties. So we've not seen any movement yet, but it's something that we are anticipating. And then just want to highlight some upcoming events for those who are familiar with the AGC Willis Towers Watson Construction Excellence Safety Awards, or CSEA. We have extended the application deadline through March 31st, and that is because our convention was moved from March, April to September. So we felt like, this would give us an opportunity to allow those who missed the December deadline to submit if they were interested. So you can follow that link there, and you have until March 31st. We will have the initial judging during, the month of June or July, with finals judging taking place during convention. For those who have been through it, I think it's a pretty fun and exciting process at the finals judging phase of it. You go before a panel of 5 independent judges, and you give a 5-minute presentation with 10 minutes of Q&A, and first, second, and third is determined. I call it in real time, and then we have a large ceremony and celebrate the accomplishments of those applicants. July 2021 AGC Construction Safety and Health Conference. That is scheduled for July 20 to 22 in Washington, D.C. We're hopeful that we are able to pull this off in person. We've had our past 2 conferences virtually, and the feedback we've gotten from attendees, while they felt like it was, good content and information, they really wanted to get back to our in-person style meetings. So our fingers are crossed that we will be able to pull this off. As states start to relax their restrictions, we're hopeful that DC will be in a place at that time to allow for us to gather with little to no restrictions. Of course, we'll still follow the established public health protocols, face masks, social distancing, disinfecting, and so on. It's more of the capacity limits that would, prevent us putting on a program as we have in the past. That's what I have. I hope you all found it to be informative, and I'm available to take any questions right now if there are any.
Hey, Kevin, since I have the privilege of hosting this event, I'm going to ask you to go back one slide so we can see the events. And I'm going to ask you, so in September, AGC of America's convention is going to be right here in lovely Orlando, Florida.
Yes.
Are you going to be there, sir?
I will.
All right. And are you going to have some safety content so that our safety folks would find it interesting and find an excuse to come up and bring their families to go see Mickey Mouse and get some good AGC content?
No, I'm glad you brought that up, Carlos. We don't just conduct the safety awards is not the only safety focused programs that we have at convention. We do offer safety educational tracks over the course of convention. I think it's 3 days of safety and health education. So yes, there is content for the safety and health professional. And one thing that I will also say about the safety awards is that, we've seen over the years where, ADC members come just to sit through these presentations and take copious notes because, during the Q&A portion or even the presentation portion, there's a lot to gain from, your peers where they talk about their safety programs and the initiatives that they've implemented. So, and at the end of it, we compile a safety best management document. If you are interested, you can go to that link, and we have the latest version up of it now. And that's something that we do in partnership with Willis Towers Watson. We compile all of the information that we've collected over the course of the 4 days of judging. In addition to what the judges' notes contain, we also have 2 volunteers who sit in the back of the room and take copious notes as well. And we take all of that information and put it into one document. So yes, there is safety content for the safety and health professional during the convention. Is there open bar available during that session? Open bar?
Yeah.
That's
just the Miami in me, man. I'm kidding.
I was saying we can work on that.
We got to work on that. Great question. So, hey, let me see. I'm saying folks are telling me that they had all their questions answered, which is great, but I got a couple for you. So hearkening back, one question that I have here is regarding citations.
Yes.
And if you foresee citations, I guess it's in reference to when you said that the medical construction is going to be broken out from the medical industry and put in with other industries. Will the citation be the same amount for construction as it will be for the medical industry? Yes.
Okay. The serious, if they deem the violation to be serious, you're going to be subjected to the highest, penalty. They very rarely issue, the max penalty, but yes, it will be, depending on the circumstances surrounding the violation. Yes, you will see penalties of equal amount.
Yeah. And I'm getting a couple direct comments telling me that it's going to be a rough 4 years coming up for my members. But very quickly, another question. And by the way, folks, if you're out there and you have a question, this is a great opportunity to ask someone that's in the mix up there in the federal government, in OSHA, where all the rulemaking is made. So if you have a question, take advantage and ask. One more question for you, and this is regarding when you were talking about cranes. Is the weight that can be lifted a factor if one needs to be a certified crane operator? I'm wondering if that might be a little bit too specific.
No, it's not too specific, and the answer is no. The crane standard, the scope applies to any equipment that can hoist So, you know, regardless of the weight that you're lifting, if that piece of machinery has the capability of lifting 2,000 pounds, you fall within the scope of the rule.
Awesome. And I'm going to give them one more second to see if there's any last second questions that come in. As someone said, responding very, very, very happily to your answer. Thank you very much. Any other questions, folks?
One thing I'll say is that you know, there are some just to give an idea of, you know, some of the strategy thoughts or ideas that are being put out there. You know, there are some who are looking to sue OSHA over this ETS, depending on what it contains. So, you know, I would say that, you know, AGC is not there yet, you know, for a variety of reasons. But, you know, if there are some, you know, requirements within it that we feel are unreasonable, we will join our coalition partners in this litigation. But at this point, we are not there yet. So, you know, and I say that just so that folks know that, you know, just because OSHA issues the standard, you know, we don't have to sit back and accept it. You know, we can try to work with them to make it better.
Okay, great. So here we go. Does the medical marijuana proposal eliminate reasonable suspicion testing?
That is what, you know, and again, that's what the legislation is absent of, is any clear guidance to employers. They only speak directly to those who have employees that fall under the DOT regulations for drug testing. And they are very silent on, you know, the broader, I guess, population of employees who are not under the DOT regs. So again, we're looking to seek clarification on this. Not for certain, you know, where they'll go, but right now, you know, the way it's written, it just says that only employees who fall under the DOT regs are subject to drug testing for marijuana.
Okay. All right. Any other questions, folks? I think we're good. Kevin, I'm you know, one great thing about being able to do these sessions using Zoom is that we're able to get you on here with us, man. So this has been great. First time I met Kevin was actually at a safety convention, an AGC safety convention that he held right here in Fort Lauderdale. And I'm really, when are you coming back down to Fort Lauderdale or Miami?
Not for certain. You know, we are always looking. Yeah, this is, you know, our pattern is this. In January, we try to find somewhere that, you know, gives folks in the colder climates a chance to escape that weather. But not too terribly warm. So I don't think it'll be in the too distant future that we find ourselves back in Florida. And of course, it would be January.
All right, great. So I got one more question before you go. I'm just going to take advantage of you being here.
Oh, of course.
Conflict between legal fed use of marijuana and keeping a safe workers. Please expand. Let me see if I can. I think you see the question there. I'm trying to see conflict between legal federal use of marijuana and keeping a safe workplace.
Yeah, that is exactly what, you know, our concerns are, is that, you know, the way that this legislation is written, it seems to, you know, kind of hand tie or handcuff an employer from maintaining these drug-free workplace policies as it relates to marijuana. You know, I'm assuming that, you know, the way it's written is that, you know, all other drugs are, you know, still fair game under your drug-free workplace policies, except for marijuana. And we want some clarification on that. You know, one of the things that, especially given the fact that there's no, you know, impairment threshold established at this point in time. So, you know, we agree with that. There is a conflict, and that's what we'll continue to work with the legislators on.
Yeah, awesome. And guys, you know, AGC of America's Government Affairs team is out there working hard. You know, with Kevin advising them on what's going on with safety and health, you've got a very strong team out there fighting on all of our behalfs.
Yes,
So with
we
that,
have I was going to say we have a dedicated lobbyist on the labor issues, including safety, and we work very closely together.
Yep. So, folks, thank you all very much for joining us today. Kevin, thank you for being here, man. Hopefully we get you here soon in person. And like you said, we'll get you here during the winter months, my friend.
Of course. Looking forward to it.
So, folks, next month's safety session will be held on April 14th. We're going to be discussing heat safety on the job site with a panel of experts. It's already going to be getting hot within the next couple of weeks. So, you know, we need to make April's the perfect time for us to start discussing heat safety. So registration for that will be open later this week. I got some final thank yous again. Kevin, thank you for your time today. Milwaukee Tools, Uriel, thank you to your and team for the support. Kelly Cronenberg, I feel nice and warm having Tim and Cedric out there backing me up on the technology side. Safe Right Solutions for hosting us, and the members of our safety committee who put together what our programming is going to be for our safety sessions. That's Deborah Hampton, Ian Schwartz, Jose Bobadilla, Mark Leon, Enrique Sequeira, and Brian Cardona. If you guys, you folks out there, have any suggestions for topics, anything that you want us to see cover, let us know. Drop us an email. You can reach me very easily at carlos@sfagc.org. Once again, carlos@sfagc.org. There's a lot going on for events. I mentioned Contractors and Clays. Go to our website to check that out, sfagc.org. I look forward to seeing you all next month. Thank you all for joining us today. Have a great day.
Thank you, Carlos.
Thank you. See you guys soon.